All right, we got part 2 of 4 running form faults that can cause low back pain. So this time we got the Sloucher. I don't know what Fantastic Four character that is. I just typed in, he's slouching, that's it. So what does this look like? Why is this bad? You'll notice that I'm rounded forward, collapsed in my chest, shoulders rounded forward, head forward. I lose that normal reverse curve of my low back. There's something called disc that separate out each vertebrae of your spine. There's different things that load that disc, standing versus sitting versus being on your back. When I bend forward like that, I'm loading or compressing on the disc. If you're slouching like this when running, I guarantee you're slouching when you're sitting at the desk, at work, on your phone. So how do we identify it? If you look back, I've got 2 different running analysis tests, if you will. We got the green screen. That's your quick and dirty, basic 4 for your do-it-yourselfers. This would fail criteria 3. And the yellow analysis is a little bit more in depth. There's 10 criteria. It's meant for your coaches, your clinicians, your physical therapists, anyone that is working with runners. So the main way that we fail criteria 2 of having your torso and your tibia parallel is this slouching. So this is what it looks like. You're gonna see it from the side view. You'll notice I'm not actually overstriding, but I've got that rounded shoulders, forward head, loss of that normal curve of the low back. Here is a good drill. We talk about sometimes there's running metaphors or things that you think about. This is an actual drill that you do that should be able to make your body used to that movement pattern and inject it into running so it happens automatically. Here's the starting position. Here's the ending position. So there is your goal, to keep contact point with the back of the head, between the shoulder blades, and the sacrum right here. So here's the setup. All you need is that broomstick or the dowel, an 8-inch step, and you need to be able to, when you measure it out, the distance, step back so you're balanced on one foot, and make sure that step falls underneath the ball of your foot. You'll see why that is in a second. So again, stick comes off, you fail. What the 2 most common things that we'll do is, 1, I'm trying to initiate that forward movement, leaning with my shoulders, leaning with my back. That is such a common thing that we do in life when we're brushing our teeth. It's more stress, more torque on your spine. So if I'm initiating this forward movement with my shoulders, if my shoulders are going past my hips, a lot of times that is coupled with me having this slouching posture and position. The second, which is the most common, I believe, is this protective mechanism. This is instinctive, this is built in you. As I'm going forward, my center of mass is going forward, what is going to prevent me from falling smack on my face is my hips are going to come back to try to bring my center of mass back with inside my base of support. So natural reaction as I'm starting to fall is I'm going to try to stop that by my hips going back. Those 2 are criteria to see that you will fail this test. Here's what it looks like in real time. Fail. Fail. This is what it looks like successfully. So you're seeing I'm maintaining contact point along the head, along the middle of my shoulder blades, on my spine, and my sacrum. And I'm going to want to practice this on both sides, where I'm falling forward, hinging at the ankle, keeping that dowel in contact, both the left and the right. So because you don't run down the street with that stick to give you that feedback, at least I hope you don't, we've got to train your body to adapt without that. So this is what we do. We give you some tools, some accessories, some props. We get your body used to it, give you the feedback, and then take it away. And can you maintain that same posturing without the feedback? So now I'm going to take away the dowel, and I'm going to use just my arms in kind of the running position. And same thing, make sure I'm not pooching the butt out. That would be a fail. Again, making sure I'm not pooching the butt out. So this is what it looks like. So now that you've mastered it, where you're falling forward, keeping that dowel in contact in the 3 points and landing on that step with both the left and the right leading the way, let's make it even more specific to running. This is going to be that final step that you should be able to translate into your running. All the same rules apply. Trying to maintain that neutral spine position, landing soft and quiet on that step. So I hope that made sense. Please go ahead and give it a try. Even without it, see what happens. Can you fall forward, hinging at your ankles, not at your hips, while maintaining that neutral spine? Hint, the next one is going to be opposite. It's going to be that lumbar locker. We've talked about that a little bit previously about why we do that, but how do we fix it? So questions, comments, concerns, you know where to put them.